live in HD. This is Fox 6 News Sunday.
65 million Americans suffer from back pain that does not respond to conservative treatments. Patients are typically faced with a difficult choice to either undergo surgery or live with the debilitating pain. Dr. Bradley Goodman at Alabama Orthopedic Spine and Sports Medicine Associates is here with details on a new non-invasive treatment for back pain. And Dr. Goodman, this is very encouraging for a lot of people who hate the thought of going through surgery.
And finally, the concept of trying to regenerate the unhealthy discs in the back is starting to become, at least we're getting closer to that reality.
That's good. Now, how does this work?
What we do is we take donor cartilage from young donors, and we take those cartilage cells and we inject them into the disc space, and with the hope that that will allow the disc to undergo a process of regeneration and become more of a healthy disc than a degenerated disc.
What about rejection?
That's a great question. These cells are so immature that at this point we're not seeing that these cells get rejected. It really becomes a question, can these cells survive inside the disc and do what we're asking them to do, which is to produce collagen and make the disc become a better shock absorber again.
Who's a good candidate for this?
Well, that's another excellent question, Karen. The study we're doing is looking at people that have had chronic back pain for more than 6 months, have not had any surgery before, and have some very mild to moderate one-level disc degeneration. Now, whether or not that proves to be the best candidate for this procedure, we don't know. But that's what we're looking for: people that have chronic back pain with only one level, mild to moderate disc disease.
And studies that you've done, I'm sure, have shown that it's a fairly high success rate.
Well, that's what we want to find out. We don't know what the success rate is, so specifically we want to see if this is going to work at repairing the disc as opposed to just alleviating the symptoms.
So when a person goes through this, they're like in a twilight sleep, like if you're going through a colonoscopy.
Exactly.
You're not really aware of what's going on.
Yeah, you don't really feel very much. It's a very comfortable procedure.
And it takes not long.
It takes about 5 minutes, maybe 10 minutes. Really, the procedure is done before the procedure in terms of preparing the cells and getting them ready to be injected. But the injection part is relatively simple.
So if a person sees this and thinks maybe they would be a good candidate, they should talk with you guys and maybe...
They should either contact our office or our research group that sort of helps us with the details of the study.
Yeah, I imagine there's some that are going to be great, some that are not so great.
Well, as far as the study goes, there'll be some that are excellent candidates and some that just don't fit the protocol, unfortunately.
Well, hopefully it'll eventually work to help everyone alleviate all this horrible pain.
That would be wonderful.
Thank you, Dr. Goodman.
Karen, thank you. I
nice
appreciate
to meet
it.
you.